My name's Sarah Chute. I'm a registered massage therapist. I am in Ottawa, Ontario, and I've been doing massage therapy for about 15 years. I incorporate microcurrent point stimulation into my practice for the last 4 years, and I've been loving it. PS, 4 years. And massage for 15. Like I just do it all the time, and it resonates with me, and it's changed my practice. And it's changed my personal life. It's impacted my life so much. And I think that I really enjoy it. Like I get really passionate about it because I can treat all the things that Swedish massage can't treat or is not effective, you know? So, and this is why I'm always looking to try different modalities so that I can get those therapeutic outcomes. And MPS, I'm just like, I could cap it at MPS. MPS has really changed the way I look at the body because we can't make a change in the body until we work with that nervous system, because that's the command center for the muscles. So it's a hack. It's the best hack. Well, we just went to my dad's. It was a 4-hour drive. My oldest always gets sick. Pop out the Dolphin, do the nausea points, boom. Yeah. It makes a trip that could be totally disastrous and stressful into something that's manageable. Whenever Dio gets sick, he's like, Mom, can you zap me? Or if he gets a headache, Mom, can you zap me? Like, it's incredible. As a homeschooling mom, your teacher, like I wear so many different hats, right? So sometimes if Deo is getting really worked up, I do the golden triangle, calms him down, he goes right back into work. That's what our jobs as parents are to do in the first place, is help our kids to calm down. So then I have this tool, like it's just another tool in my toolbox. It's amazing. Well, we feel helpless when our kids are sick or suffering. So just having the MPS alone has given me so much peace of mind, because at least I feel like I'm doing something as opposed to just watching my kids suffer. And it's quick and efficient, you know. Instead, he'll go and have like an hour-long hissy fit. If I can zap him and calm him down, like I haven't lost my entire day to a hissy fit. Because as parents, as adults, I feel like we hold on to stuff a lot more than the kids do. Kids, like, they have their moment and then they've completely switched onto a different emotion. Whereas for me, sometimes I get stuck and I'm like, I'm still angry or whatever. So I will go and do my parasympathetic points and I will calm down. So it makes me a better mom. It makes me a calmer mom. I don't know if I can answer that, because what I love about MPS is that you can treat so many different conditions and so many different types of people. So no one treatment's the same. So like if someone's in pain, right? MPS protocol, like standard protocol, boom. But then if their stress levels are really high, which I incorporate now into my intake form. So if they're really high, then I'm going and I'm doing vagus nerve. I love scar therapy. Honestly, I feel like I could just do scars. I could also just do VNS, because everybody is stressed out. And it is what I've seen, like symptomology go away, but just by using the VNS is incredible. I think anxiety, like I have had several clients who feel like they're having a heart attack. They go to the hospital. They've been to the hospital 3 times. They've had all the tests done. Nothing shows up. Everything's clear. They get on my table. We do 1 session of VNS. Symptoms go away. And then they start to realize, wow, this is stress, because then after like a month or 2 of being at home, they can feel those symptoms slowly arise. They come back for another treatment. No more symptoms. Because you're able to get people into that parasympathetic state so much quicker. So like even in 5 minutes. And what's great is when you hear your clients talking, okay, and I've got the VNS running and I'm massaging, they're yappy, 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 yappy. And then all of a sudden they stop talking. and you know they've just switched. So that is, efficiency is a huge thing as a therapist. The quicker I can get my clients into that state, the more efficient my treatment's going to be, potentially better, longer lasting therapeutic outcomes. And they're happy and they feel it and I see it. I honestly do VNS on probably 90% of my clients. It's how I start almost all of my treatments now, VNS. One cycle, blue tip, turns off, flip them over, go into whatever else I want to do, and that's it. The only time I end with it is when I do scar therapy. And even with the MPS, so I treat a lot of colleagues, and so I treat them for their pain, and so I do standard protocol, and now my colleagues can't imagine not having MPS incorporated into their treatments, and they go out and purchase the Dolphins so that they can incorporate it into their treatment because they know firsthand how it feels and how they've responded to it. So that's cool for me to be able to share this with like people, you know, my colleagues. We want to make people feel better. I think honestly, everybody, if you're serious about treating your clients and getting your clients better, quicker, they should incorporate MPS, and it's going to make you a better therapist. The information that you supply in your courses are incredible. Like the scar therapy, again, this is not something we're taught in school, and nobody is treating scars. Nobody. So this is what I'm saying. We could all just focus on doing scars. Even the emotions tied into the scars. These are things that people aren't treating. So as therapists, MPS is only going to make us better as therapists, and like, period. It's going to push you into a whole other category. Mastectomies is a huge one. Yeah, it just seems like almost every single time I do a scar release, there is a huge shift. A lot of clients end up crying. There's an emotional release. Scar therapy is magical. And for myself, just for myself, so because I run a lot, and I run to help with the stress. So like I do it for my brain so that I can just manage my emotions and my stress levels and whatnot. But if I tweak my ankle or I sprain my ankle or I get to do the vagus nerve stimulation to help me recover. Because I know, I mean, Dr. Bruce tells me, and I totally believe everything Dr. Bruce says. It's too much, I need that recovery time. So I'm able, again, to kind of hack my body to do the things that I know might not be so awesome for my body, but my brain, like I need it for my mental health. So, and that is a huge thing. So yeah, because I run 5 days a week and I do the VNS, like I don't really ever get injured. So now I can do 10K in under an hour, like about 56 minutes, whereas before it was about a minute or an hour and 12 minutes. So I've shaved time off my running and I feel more relaxed. So, right, like when you're running, you want to have good form. So I'm not like super stressed out when I'm running. I feel really good in my body. And I only do VNS like, 2-3 times a week. Well, people I don't think realize how stressed they are. And this is another thing that's changed kind of my practice is you ask somebody how stressed you are. Oh, I'm not stressed. And then we go do vagus nerve stimulation and they go from here to here and they're like, wow, I'm stressed. They don't know it until you're able to pull them out into a different level. So a couple years ago, 5 years ago, I started reaching out to different companies because I wanted to review different products and different courses and then review them on my blog so that I could help other healthcare practitioners find different modalities and different techniques to incorporate into their practice. Because all of this stuff costs a lot of money. So I knew about the dolphins for a very long time, and Dr. Bruce was one of the companies that I wanted to reach out to. I reached out to him asking him if he'd be interested in collaborating with me. And he, to my gratitude, said yes. And went up to Toronto right before COVID hit. I did your intro course, gave me the dolphins, and I've been doing it since 2019.